Why does my wisdom tooth hurt?
There are two reasons why your wisdom tooth could hurt. Reason number one is because it's decayed and it needs attention, like a filling or to be removed. And the second reason is because there is not enough space for it to erupt.
Why is there not enough space for my wisdom tooth to erupt?
The problem is that the size of our teeth is genetically encoded. So we have had the same size of teeth for the past 1,000 years maybe. And the size of our jaw, though, this depends on the food we eat. And because lately, few hundred years, we've been eating lots of soft processed food, our jaw doesn't grow that much so that to accommodate all our teeth.
Why do I get episodes of wisdom toothache?
Because our teeth erupt in waves, so they will erupt for 1-2 weeks, for example, and then for maybe a couple of months they will just get some rest, and then they will start erupting again. So it takes sometimes years for the teeth to fully erupt, especially the wisdom teeth. So it will happen again and again and again until it is fully erupted.
Do I need my wisdom tooth removed?
Sometimes you do. Depends if the tooth is erupting straight and if there is enough space for it to erupt. Unfortunately, lately we get lots of cases where we need to have the wisdom tooth extracted, and that's because there is not enough space. But if there is enough space and if the tooth is erupting normally and it's not causing you any problems, then it's absolutely fine. You are advised to keep the tooth.
I've been told that my wisdom tooth is able to erupt straight, but I'm experiencing pain. Why is this?
When the tooth erupts, it cuts its way through your gum, so it's absolutely normal to ache. Most of the times we get a small infection of the gum area around the wisdom tooth. We call it pericoronitis. And you need to maintain very good oral hygiene in the area. You need to make sure you brush. I know it's tender, it's sore, but yet again you need to brush it very well. A mouthwash would help a lot, or rinsing with salt and water. Sometimes the gum is so infected that you will have to have some antibiotics to fight the infection. Otherwise it may take for a long time until the gum settles and the pain disappears.
Why did my dentist tell me not to remove my wisdom teeth?
Most of the times the roots of your wisdom tooth are very close to the nerve that gives sensitivity to the lower arch, to the lower cheek, teeth, tongue, lip. And there is a small risk, but it exists, it's there, it's real, to lose sensitivity maybe forever in the whole area. And because of this risk, most dentists advise, if there is no problem and if you don't have any serious pain and if it's not growing sideways, just don't touch your wisdom tooth.